Good afternoon, everyone. I welcome you all to this webinar for today. My name is Aishwarya Yoganathan, working as a medical officer at Lanka Hospital in the IVF Center. It's my pleasure to welcome you all to this webinar program titled today, Maternal Health and its Safety. I'm pleased to welcome the speakers for today's program. These would be Dr. Nishendra Karunarathne, resident consultant obstetrician and gynecologist at Lanka Hospital, Sister Janani Kumara Singh, nursing officer at Birthing Center, and Dr. Jagati Fernando, HOD of Pediatrics and acting HOD in Obstetrics and Gynecology Department at Lanka Hospital. Firstly, I would briefly acquaint you with the few topics what we will be discussing it for today. The first topic will be maternal health and its importance, followed by patient safety and well-being, and the final topic will be the healthcare facilities which is available at Lanka Hospital. Before proceeding with the first topic for today, audience, please, you can inbox us your details as well as the questions which you wanted to ask from us. We will be able to reply to it after the end of the section as soon as possible. So allow me to start up with the first topic for today, which will be maternal health and its importance, which will be presented by Dr. Nishendra Karunarathne. Over to you, sir.
Yeah, good afternoon to all the viewers. I'm Dr. Nishendra Karunarathne, working as the resident obstetrician at Lanka Hospital. Today, what we're going to discuss today is the maternal health safety, the responsibility of healthcare professionals. You have a responsibility to look after your pregnancy, and also if you come to our care, we have a responsibility which is more important to look after you. And certain things we have to know what the doctor's role in caring a pregnant mother. So then you can get the optimum care from the hospital as well as from the antenatal clinic settings. So we're going to discuss some important topics and some important areas about the responsibility of the healthcare professionals and as well as from the hospital itself. The maternal health is also another entity in the healthcare sector, and we all know the patient comes into the care of the hospital and to the different from the other patients because they are not patients. They are all healthy women. And sometimes they might have some medical problem, but majority are healthy women planning to deliver a healthy child at the end of the uneventful or uncomplicated pregnancy. So they have more expectations and more more things that they want to get from the hospital. And also in here, the doctor has to look after not only the mother, the developing baby inside the womb as well. The baby doesn't talk, and baby doesn't show any sign from outside. All what we have to do is we have to talk to mother and get the detail from the mother and then do the examinations. And sometimes we have to use some tools and instruments to know how the baby is developing, whether the baby is developing healthy inside the mother's womb. And a few things about the first consultation. And when you come to see a doctor, the doctor should take a good history. This includes the present complications, present complaints, and what the patient feel about, and patient's general health, and also the very important to ask about the past medical details. And the patient also should be ready with all the notes. If they have any medical condition, when they come to the first consultation, they must provide all the available medical notes. Then the doctor can identify any medical problems in details and categorize whether it's need to be addressed during the pregnancy or it's could be is it something not that relevant to the pregnancy. And we always tell the antenatal care should be done with couple, and in the first consultation, husband and wife preferably should come to the hospital because there are a lot things. There are major role the husband also should play during pregnancy. The husband should know about the pregnancy, and he should know about how the baby is developing, and he should know about how does he, if there's emergency happens, how he has to attend to it. So everything is matters to take his wife throughout this career, and at the end get a good outcome and have a healthy baby. And clinical examination is also important during the first visit. So we look into the mother's weight, height, other parameters, signs of medical complications, and also anything that we can pick up from the examinations to make a diagnosis. Sometimes you might know, we might be able to identify a new thing in your which related to your medical conditions during the first clinical examination. And then once you get history and clinical examination, we categorize whether this mother belongs to low risk category or a high risk category. If it's a high risk category, then we plan for a specialized care. Most of the time, we need help of another specialist, which is relevant to that particular medical condition. And we should have the support from the other medical entities as well to overcome these medical conditions, and then not to have any complications to the pregnancy due to those medical complications, which is usually happen if you neglect or if you're not being able to manage them properly. And the referrals and specialized investigation are paramount important. When we detect some medical conditions, we always should refer the mother to a specialized area. I will discuss in more detail about those things before we start the antenatal care. And on uncomplicated mothers, we initially make about how should she come to the hospital and how often come to the hospital, and the investigations, the scans or testing and everything in details. And also we should answer all the questions that they want to know about from us. So relate to the pregnancy. When you get pregnant, there are so many informations and advices comes from different sources. Maybe your parents or from next door neighbor, your office colleagues, and everybody comes and say, and they greet you as well as tell you not to do this thing, not to do the other thing. Maybe you should not do certain things that could affect your baby and all. So then the pregnant mother will wonder, actually, are they real? Or are they really the correct advices? Or whether I have to follow these things, or whether how could I get this correct information? Sometimes you might go to the websites. Those sources also, not all the sources will tell the same thing. So the best person to ask is the doctor. Once you come to the hospital, you must talk to the doctor and ask, even if you have any doubt about the simplest thing, you still ask. There's only one or two the word answer would help you to clear your doubts and then help you to follow the correct advices. And there are so many common myths among the general publics. Some say not to eat some food. Some say you have to sleep on a different angle. And some say you should not travel, should not, the sex is not good during the pregnancy. Those all are myths. So if you ask or if you advise the patient correctly, and then these things, you can just get rid of the unnecessary fear, the unnecessary limitations and everything. If you concentrate, or if you get to know the information only from your obstetrician or from the health staff. And also we try to build a friendly relationship and trust between us and the patient. And also we are happy to listen to the patient's worries and queries and any doubts about the pregnancy. So maybe something not related to pregnancy also, you can talk to us and sometime you might be able to find a solution. And the best possible care, there were no role or maybe the responsibility to give you the best possible care. Guidelines, these guidelines are being come from different sources. We should update these guidelines time to time and according to the current trends, and we must provide the best possible care according to these guidelines and the protocols, which is it should be individualized. Is not all the guidelines are appropriate for all the patients. We must understand the patient's conditions and the medical conditions, and these management systems should be tailor-made for the patient's needs and the medical status. And also we can guide the patients to select the hospital as well as the places where the healthcare facilities available. For example, if a patient is having a heart disease, cardiac disease, obviously that patient should deliver in a place where all the cardiac intensive care is available. If the baby is not doing well, if the baby is having some growth restriction or baby needs some support at the time of the delivery, the baby should be delivered in a place where the neonatal care is provided. And also we must use the best diagnosing tools. This is more relevant to the ultrasound scans. The scans are different. Some scans we can see the basic thing, but to do the specialized scannings, we need to have a very sophisticated high-end machines. They are actually expensive, but you must use those instruments to diagnose correctly the fetal and the medical conditions. And the referral, as I said, if we find any complication, we must refer them to most competent and appropriate colleagues. There are doctors who are good in this field, who are very interested in maternal medicine. So if you refer the patients to those kind of people and those kind of colleagues, then we know that the care will be more than just making a referral to another hospital. And it's also important to work with a competent team, and not only the obstetrician looking after the patient. The team comprises of junior doctors, the anesthetist, pediatrician, sisters, nurses, the in-charge doctors, and subordinate. Even the one who works at the lower level also has a role to play. So we always must encourage them and should make a role model for them, and must tell frequently about the importance of the maternal care. And if we work hard, if we work competently, then we know at the end the mother will get the best outcome. And to maintain the standard of junior staff, when there's new thing comes, you can teach the junior staff and also encourage them always update their knowledge. This is what I mentioned about the ultrasound scan and all. So this is the scans of a very high this structure you can identify easily. So they always must do a good scanners when you do the scanning. And also the healthcare team, we work as a team. We always encourage our team members to be friendly and to happy to answer questions. Sometimes the patients might not be didn't have time to ask questions from the consultant, but still can ask questions from the nurse who is in charge of the clinic. And they should be contactable and the availability is also important. When you come to the private sector, there are certain things that you have to verify before come to the hospital, and you may have to call us or maybe send some maybe some information in other means. Then we should be able to make a source that you could contact us at any time. The availability is also very important, because you always expect us to look after you when you come to the hospital. So we must adjust our timetables and the working hours, the working places accordingly, which could give you the most appropriate care. And also they should be able to attend to emergency promptly. So this is the more important, another important area. If a mother comes to a hospital with emergency, for example, you start bleeding and your placenta is separating, if we are ready to accept you at the doorstep, then the outcome will be good. But if we make a delay and taking you up and taking you to theater, if you don't have facility to attend the emergency promptly, then again, you might survive, but baby might not ended up in good condition. So always make sure that you are available for the emergencies, and also team. You must have a good team to look after the patients, and the team members should have committed and the competent attitude when they work with us. And also the other thing, information. We always provide the patients the correct information. Now we do the scan, if you find something wrong, and there's a way that we can break the news, and we can just pass the information to the mother and father. And it's done in a very empathetic way that they would gradually get accepted it. And not only that, we must tell them what is the next step, what we could do in the next step. So not all the pregnancies are going smoothly without any problem. Sometimes they come across complications. So then we must provide the correct information, and then help them to overcome what could be the adverse outcome if addressed not properly. And the confidentially is always, we must make sure we do not discuss about the patients outside. Maybe you're known, or somebody who's known to you comes and asks about your conditions, and we never divulge the informations. That's our medical ethics. And also, in case we want to discuss your case, if it's medically important, we always tell you, now we're going to talk about this thing because this is important for the medical education, but we still have to take your consent about it. And always we must maintain the caring and the helpful attitude. Finally, the cost, you come into the private sector, and you must be having some limited budget. You must know how much roughly, or maybe you have to pay for the maternal care. And we provide that, the information about the surgical fee or maybe the hospital fee. We should be able to give you estimate how the correct cost that you. Second opinion is very important. Sometimes patients, they're reluctant to ask for a second opinion, thinking that doctor would think that the patient does not believe in doctor. No, it's not like that. Second opinions are always helpful. If you have any doubt about the management, if you have any kind of different opinion about the management, you may ask the doctor, is there any possibility that we can get a second opinion, which a doctor should be ready to give a second opinion. In our case, if we have some doubtful situation, or maybe we have an unexpected situation, we always refer the patient to another colleague to get the second opinion. So the patient get information from us as well as another colleague, another doctor. So then the patient understand, right, this is actually what has happened. So this is what I had to do. And also some colleagues are better than us that we have to accept. For example, if you do a scan and see the baby's heart is not good, then we get the opinion from a pediatric cardiac specialist, which by his scan, he might tell us not only what has gone wrong, what could be done for this thing. So always second opinion should be accepted and should be welcome. And also we should help our colleagues. If a patient of an obstetrician comes to the hospital, by any chance that colleague is not available, the patient should be able to get care from another colleague. And the patient should not think that I will not be treated by another consultant because I belong to a different doctor. That's not like that. So everyone of us looking after the patients, regardless of which consultant the patient had gone into. And also should not have a fault-finding environment and should not blame the patient. It's true that no one can follow all the medical advices we give you. And also, if something goes wrong, many of us, and maybe even the patient would try to find out this happened because I did something wrong in the past, which is not true. If something happens by any chance, you always must console, like make the patient try to be very sensitive and empathetic about the patient and get the patient out of the trouble, and then make sure that patient is not getting upset and go into a blameful environment. And we all have commitment. I would say that all the jobs have commitment, but in medical profession, we should have more commitment because we are dealing with lives, not only the lives. Sometimes, in case now commitment, we don't commit to our job, then the adverse effects or complications could not be reversed, and it could be a suffering for another individual for rest of their life. And I just want to, before we this the antenatal card we were providing you in our hospital, and you see we provide you some helpline here, which is the contactable at any time, and also the general numbers, birth and center, everything, which are just somebody to call coming from that end as well. They try to contact us anyway. So this is these numbers will helpful to you in us. So then this is the plan which we make at the beginning. So these are the weeks and the procedures that we have to go through, and the medications. And even if you miss a kind of, if you forget something that we explained to you at home, once you go there, you would go through this and would understand. Now the next step would be this, if we make a plan out of it. And these are all the other medical history and all what we have to fill while you're coming to the hospital. And then these are some advices. So those are general advices about your food, diet, exercises, traveling, sex, and most of the thing we have written down here. So you can go through and refresh your mind. And then certain important things you need to know about the immediate medical attention. If one of you are going through one of these conditions, you should come to the hospital immediately, and your details and everything. So all in all, we here, the medical staff in Lanka Hospital, try to give you the best possible maternity care. I hope my colleagues will explain about the facilities we have in the Lanka Hospital. Thank you very much.
Next speaker for today will be Sister Janani Karunarathne, who will be dealing with patient safety and well-being. As I already said you, please inbox us your contact details and further questions what you wanted to ask us. We'll get in touch with you as soon as possible after the session.
Good afternoon, I'm Sister Janani from Lanka Hospital Birthing Center, and today my presentation focuses on the patient's journey during the hospital stay. So in this presentation, I'm just focusing on how to ensure safety and well-being of you and your baby before, during, and after the birth. As maternity unit at Lanka Hospital, our services mainly focuses on 24/7 mother and baby care with the specialized care team, along with multifunctional and fully equipped care suites. So our team is welcome first, and include, when I'm just considering about the department that we are just including, the heart of the maternity team is the birthing center. Then we are just deal with neonatal intensive care unit, general operation theatre, intensive care units and high dependency units, and mother and baby care units. So when it comes to birthing center is the place where we receive outpatient-wise patients who are just having antenatal pediatric complications and the patients who are just willing to go through induction of labor and the emergency labor. So when it comes to how we do care our patients during your hospital stay, before delivery, during delivery and after delivery, further slides will describe how I just gonna explain about your care. During your antenatal period, and in order to ensure your awareness, we conduct several kinds of programs. When it comes to programs, parent crafting is the major program that we are just conducting during your antenatal period. It mainly focuses on education during antenatal period, how you have to adapt for your pregnancy journey. So when it comes to the educations, we always introduce you the precautions that you have to follow during your pregnancy, and further how you have to modify your life for journey of the pregnancy. Thereafter, when it comes to familiarization program, when dates are due, we always orientate you to the surrounding of the hospital and where you take place the admissions and how do you need to proceed the admission process. And when it comes to the delivery, we are just orienting you to the labor room surroundings. So when it comes to the hospital stay, we ensure your maternal well-being, pain management, infection preventions, and baby care. So during your admission process, when you just stepped into the labor rooms and especially the hospital environment, you are severely anxious because it's maybe your first or second, but it's your joyful beginning. So when we consider about the maternal well-being, we ensure your safety in adherence to national guidelines of the maternal care. And we offer you thorough monitoring with friendly environment and one-to-one patient care environment. So during your we allow your loved ones to be with you. Though it is COVID pandemic, we are following here. So in the meantime of your labor, we offer you the spiritual substitute to encourage your loneliness and anxiousness level and enhance your mental well-being. During labor, the pain is the most important matter we always consider. So when it comes to pain management, therapeutical management and non-therapeutical management. So main thing we focuses on non-therapeutical management is we allow your loved ones to be beside you to encourage you and share your pains and tolerance. So further, we provide you music therapy, breathing exercises, fomentation to relieve pains, and positioning like birth world and sitting, walking, and get some relaxation therapies. When it comes to therapeutical management, we offer you medications, Entonox inhalers, and if you're just not getting related pains, we educate you regarding epidural anesthesia. When it comes to epidural anesthesia, it's a procedure. We have to obtain written consent properly, and consultant anesthetist will be the person who is just providing you the epidural anesthesia. All over the pain management, we as a nurse who are allocated for you will be there for you to encourage and assist with your pain. So though there are several pain management, every time nurses are explaining the procedure to relieve your anxiousness. So the next call we are just mainly focusing is prevent of infection. When it comes to infection, that is the main thing that we have to minimize. So we provide you the fully clean surrounding with minimum obstructions to enhance your ability to work and make your position comfort. And in the meantime, we provide you the standard hygienic facilities too. So in addition, when it comes to minimizing infections, so we always try our best to follow aseptic techniques, and we always enhance minimum vaginal examinations. We perform those things and we assist for those things when it comes urgent and needed. So we also assist with providing antibiotics as prescribed by VOG after explaining those procedures for you to understand for further care. So in the meantime, we also provide some counseling on wound care and infection prevention to enhance your knowledge about that prevention of infection. So the major thing that we have to consider about during labor is your baby care. So during your labor, we monitor your baby's heartbeat regularly. So in the meantime, when it comes to the labor, we always ready to receive your baby with expertise, with modern care facilities, and always we encourage about your baby to be as health. So just after the delivery, we also always promote keeping mother and baby together with your loved ones. So in the meantime, we always targeted to provide optimal care of giving skin to skin care and even the breastfeeding within 1 hour of time. So it will help you to ensure your babies and your safety and psychological well-being too. So in the meantime, we also perform delayed cord clamping as nurses and healthcare professionals to ensure the safety of your baby and yours and reduce further complications. In the meantime, also during the labor, we also counsel you regarding breastfeeding, baby handling, and further care that we have to follow up with the baby's well-being. So during labor, or either for another incident, emergencies can be take place at any time. So when it comes to labor, if we identify any kind of emergency during our monitoring process, we activate our urgent information system to contact the consultant. Units and general operation theater, and we always getting ready for an emergency delivery to secure you and your baby. So when it comes to a joyful delivery, here the place that we are just giving you you and your baby the care. So during the hospital stay until your discharge, we monitor you and your baby. So thereafter, we educate, counsel you, and just demonstrate how to perform breastfeeding and baby bathing and other cares that we have to do with baby. So meantime to we educate you to encourage how to care babies, pampering and other things also, especially the burping is the most problem that we are just focusing on. And the next thing, especially for you, how to care about your wound. And when it comes to breastfeeding, how to care about your breast. And then after, we also encourage you to care about yourself. And when you have to call for emergency help in case of postpartum period. And in the meantime, we also always encourage you to minimize the risk of infection, especially during this COVID pandemic. So after the discharge also, we always keep touch up with you because we have to get further details about your further matters. So we review you and your baby for further issues, and we conduct free breastfeeding session when it is needed if you are just having any difficulties during breastfeeding and other issues. So finally, we are as nursing professionals and the healthcare professionals, we are devoted to ensure your safety and well-being of your baby and matter of joy. Thank you.
Just mentioned you about the facilities, what we have in our hospital, and the pain management and what we care about in labor. This will be further followed up by the healthcare facilities, which is available at one hospital by Dr. Jagati Fonseca.
Good afternoon. I'm Dr. Jagati Fonseca, acting HOD for Obstetric and Gynecology Department. I'm going to talk to you about the facilities and care especially focusing on maternal and newborn care. Lanka Hospitals is a multi-speciality tertiary care hospital situated in the heart of Colombo. And it has state-of-the-art facilities with cutting-edge technology. We have several centers of excellence, including Fertility Center, Women's Wellness Center, and our hospital is one of the most award-winning hospitals in the country. Right. And we are proud to announce that Lanka Hospitals has successfully able to sustain Joint Commission International accreditation status for the third consecutive time. And JCIA is all about the maintenance of high quality and safe care for patients. We have achieved international patient safety goals to reach milestones in high quality and safe care in our hospital. The patient safety goals that we have obtained are correct identifications of patients, and improvement of effective communication, and improvement of safety of high alert medications, and ensure correct site, procedure, and correct patient and surgery. That is the safety of surgical procedures and reduction of the risk of healthcare associated infections, and reduction of patient harm resulting from fall. We are very proud to achieve these goals to ensure the safety of our patients. Our Obstetric and Gynecology Center provides a personalized birth experience for every expecting family. And it also provides comprehensive and convenient care from conception through pregnancy and delivery to postnatal and pediatric care. We have about highly qualified, about 40 resident and visiting obstetricians and gynecologists, and neonatologists, pediatricians, and anesthetists. Our medical officers, nursing officers, and other assisting staff are also highly trained. And we have individual labor rooms to protect your privacy. And we have operation theater facilities for any time of the day to deal with any emergency, and intensive care facilities, and in-house blood bank when it is needed 24 hours of the day. We can deal with any emergency. And starting with the Women's Wellness Center, where you can consult your VOG throughout your pregnancy. The staff in the center are ready to help you at any time. It is a one-stop center to cater to all your needs. We have birthing center. Our sister Janani had spoken about the center at length. Once you enter into the birthing center, our staff will make sure to offer you all the support that you need to go through a successful normal delivery. At the same time, staff are fully trained to handle any emergency situation under the guidance of our obstetricians. And we have the maternity ward, and it's a newly built maternity ward with all the facilities to make your stay comfortable and memorable with your loved ones. Our staff will make you feel at home with their loving and compassionate care. You cannot have a maternity unit without the support of a well-functioning neonatal unit. We are proud to have our level 3 neonatal care unit with latest equipments and facilities. Highly trained staff work under the supervision of very capable neonatologists and pediatricians. We look after extreme premature babies and newborns with various medical and surgical problems. Other services that we offer are, as Sister Janani mentioned, parent crafting program. It helps to prepare you and your partner for parenthood. You are given hands-on training on certain newborn care procedures. We conduct these programs once in every month. The breastfeeding counseling, our trained staff is ready to assist you in teaching correct breastfeeding techniques, and they will make sure that you have a pleasant experience in getting to know your newborn baby. It will be the key for the successful exclusive breastfeeding. And we also have postpartum care and counseling, physiotherapy and dietary advice following delivery, and post-delivery follow-up of the mother and the baby, where one of our staff will be contacting you even after you leave the hospital to make sure that your baby and you are doing well. I'm happy to say at Lanka hospitals, we all strive to achieve our mission, which is to maintain exceptional and compassionate quality while offering cost-effective healthcare solutions of international standards. Thank you. We have received like a few questions. It's regarding about approximate charges for our deliveries. I think we'll have to inbox you privately and we'll be able to send you.
The second question is being put forth to Dr. Nishendra Karunarathne regarding what is the best angle for a pregnant lady to sleep? Is it to the right or the left?
Thank you. And the previous question about the cost and packages and all. Of course, Lanka Hospital has different packages, and they are very nominal. What you could do is, what we provide you the whole cost. The difference in Lanka Hospital packages is the Lanka Hospital tell you this is the charge that you have to pay you for the delivery, and there will be no added charges. There will be no additional things. Everything includes delivery, the medicine, and the neonatal care, neonatal investigations, the hearing test, postnatal thing, and also it's included for 2-day packages or 3-day packages. This is different from one consultant to another. Of course, if you could come to the Lanka Hospital, the admission center or the Well-Lumen Center, they will tell you about what exactly you're supposed to pay after the delivery, and there won't be any hidden charges. That's the important thing in Lanka Hospital packages. The other thing, the other question, it's really a very good question, even though it looks simple. I'll tell you a story. And I had a few patients, still can't remember one patient. She came to me and she was a very uncomplicated patient. BMI is bit on obese side, and she comes and pregnancy is going on. Each and every time she comes and tells me that she has a severe backache, and she was worried about it and asking whether she could go for any physiotherapy, orthopedic thing. And after the pregnancy only this backache has come up. And then she was sleepless, insomnia. She couldn't sleep in the night and always restless. Healthy mother, supposed to enjoy the pregnancy, and with healthy baby, the developing baby is no complication. But by 5 months, she was very tired and look inside and always complaining. So I asked the mother, so why? So I asked in details. So how do you, what is your activity and you're working, or where you wearing high heel shoes, the seating position? And I ask about the sleeping. I usually tell these things at the beginning, but I would have told, but she must have not picked up. And she said, doctor, I'm always sleeping to the left. I asked why. So I found it in a website, and even my midwife told me the best is the left is the best position. I asked, okay, now what could happen if if you sleep on your right, what your whatever the convenience is. She was clueless, but she said, I think, doctor, it harms the baby. No, nothing like that. Now you can think about our body is a physiological thing. If we can't carry the baby, if we can't provide the nourishment or the oxygen or whatever, in whatever the convenient positions to us. So there's nothing, no baby could develop inside our bodies. So there's no stance, no position to sleep. To sleep comfortably, when you sleep well, if you want to sleep on right, sleep on right. If you try to sleep on left for a long time, your muscles get tensed up and you will develop definitely a neck pain, the back pain and everything. Nothing will happen. You put your head down or put a pillow, head up or whatever the convenient position that you could sleep, you sleep. The other thing, you always think, I should sleep on left side, and you can't get a good sleep as well. Because by back of your mind, you were wondering whether I could turn to the left, right during the sleep. Would that cause any harm to my baby? No, nothing. So let you enjoy your sleep. There's nothing called that you have to sleep on the left if you are a healthy and no uncomplicated neonatal mother. Yes, of course, we keep you on the left. That is during the labor. During the labor, your womb is getting contracted. The blood supply is reduced to the uterus. And then we try to maintain the baby's heartbeat properly. We let you sleep on, we let you lie on the bed or more toward the left, but still the baby's heartbeat is not doing well. We turn it to the right. So during the antenatal care, during the pregnancy period, if you are healthy, there are no other complication, you sleep in the way, in a stance where you're comfortable to sleep. Yes, this parent crafting programs, unfortunately for last 7 months, we could not do parent crafting. And due to the COVID situation, because we were not allowed to have gatherings here, but soon we will start with the webinar. It's free of charge. No charges being taken from the patients, and any patient can come. If you go in for another hospital also, we are welcome you. And just know we will inform you in our website or whatever the information for the next webinar. We will try to, at least we will try to start it online. Once the situation is cleared up, we will try to do it on a more practical manner. Can you provide? Yeah, so yeah. The other thing, like when you come to the hospital, when you come to the come to see your doctor, don't make an assumption and come. A good example, maybe a year ago, a patient was she was complaining, she was vomiting, and she came to me and said, doctor, I have a severe gastritis. And I was also had a chat with her and said, okay, no, this patient been suffering from gastritis for long duration, and now it's become severe. She was vomiting all the time. And while I was talking to her, I was just started writing something for gastritis. This, I think, was the last patient I had to see in my consultation session. And I was did a blood BP monitor, took the BP monitor and measured the blood pressure. It was high. I asked whether you had a headache. Yes, doctor, I had headache, and this is also due to gastritis. During the gastritis, I get headache. And I checked the other parameters. She was in a severely badly compensated condition to her baby, and she was in severe pre-eclamptic status. We admitted her, and they did investigation and delivered her, and we could save the mother and the baby. But that when you come to the hospital or whatever things, you always tell what you have, and you don't think that things could happen due to the gastritis or something else, which is may not be the real situation, may not be the real thing, but could be some due to something which really need medical attention. And any other questions?
One more question. In this pandemic, is it okay to become pregnant? What will be the effect of virus on her as well as on a baby?
Yeah, I understand, and there was some discussion in the media. There was a during the news brief, some health professionals came up and told about the pandemic situation, and then he mentioned especially to postpone pregnancy 1 year, but actually that is not what actually he meant. Maybe his personal, or maybe it's not an accepted thing that we have to tell the patient. And as a healthcare professional, we believe the pregnancy, if you are at the age of preparing to make a family, and if you want to get pregnant, the other things which happen around you should not be the cause to postpone pregnancy. Now this corona is coming up. Maybe next year something else will come. And the next year you might have another commitment. You may say, right, okay, I can't get pregnant this time. I want to do something else. The exams or the professional development or any other financial things should not be considered as barriers to get pregnant, because if you don't get pregnant on the correct age, then get pregnant, you have to spend more and you have to struggle. So I would say during the pandemic season, you have to follow some instructions, do your the safety regulations, the safety measures properly, and then if you want to have a baby, there's no reason for us to say no. You get pregnant, you can look after yourself, and there are many mothers deliver during the pandemic season, and also some COVID mothers also now they delivered and there were no complications, and there were complications due to the COVID situation, which is pertinent to all the other fields as well, that we couldn't help. But not having child during the COVID situation will not be an ideal solution, or will not be the ideal answer if you want to become pregnant and have a baby and to become a family.
So, questions? Is it okay to get vaccinated with COVID?
Yes, of course. Vaccine has prevented. Vaccine prove that severity of the illness is being controlled. But during the pregnancy, if you get vaccinated, even if you get COVID, the severity, like you're getting bad, the chances of getting bad is minimal. So there are things about vaccines. Some say certain things, contraindications and all. But all in all, if the country decides, if the regulatory decides to take the vaccine, it's our duty to promote it, and also the patient's duty to take it. Because in any vaccine or any health measures, there are complications, but comparing the complications, the number of others are getting complications and the number of others are getting benefited from the vaccine, it is always advisable to take the vaccine, because the corona can cause even a fatal conditions in maternal in mothers. So especially if you're not vaccinated.
One more. If a patient becomes positive, will it have any effect on the baby?
So far, majorly no. Like there are case reports. There are some studies because this is still relatively new, but majority mothers, there won't be any little teratogenic, like the people will not get any abnormalities from because mother is getting uncomplicated, mother is getting the COVID illness. But if the mother's general health become bad, that can adversely affect the baby's outcome as well. But generally, you can't name. This could happen during the COVID. The majority who had COVID during the pregnancy had a normal and healthy baby.
The patient has asked her, she's about 7 weeks pregnant and she's positive with COVID. What are the precautionary measures she has to take?
This is as in for all other COVID patients. You must inform your healthcare, the community healthcare professionals, MOH and the midwife. And if you are having any symptoms, we have the video consultation facilities with a physician at Lanka Hospital. You may talk to us. We will have it. And then the doctor will tell you either you have to stay hospital or you have to come to the, you could stay home or you have to come to the hospital. Then depending on your consult, depending on the symptoms that you are having. If you don't have any symptoms, like if your community health professionals say it is safer to stay at home, you can stay at home. There are numbers which is provided by the government as well, medical association. You can talk to them at any point to develop application. Then you can follow the health instructions. At any time you develop any respiratory symptom or fever or anything which could cause any complication to the pregnancy, come to the hospital, which is provided in as well as in private sector as in the government.
Sir, is there any preference in the vaccine which the patients are getting vaccinated with, like something like Sinopharm which we prefer or AstraZeneca or something?
The circular issued by the health ministry, as mentioned, all the vaccines which we are using at the moment, except one, I not mentioned there, were effective during the pregnancy. And in other countries also it was said the vaccines were, you can't say this particular vaccine is good in pregnancy. This is not. There shouldn't be a preference. So whatever the available vaccine you have to take, because all are good in preventing and minimizing the COVID-related complications.
So, few general questions are not related to COVID. Is there any other reasons for patients getting continuous vomiting even after 5 months of pregnancy other than high blood pressure? Is it a normal condition?
Yeah, this is vomiting to many other reasons as well, due to the gastric irritation, which we could commonly see, and also could be food poisoning or those are things. So these all are acute things. But all in all, the vomiting associated with headache or maybe some discoloration of the skin, or you pass in yellowish, most dark colored urine. And if it's associated with certain other medical conditions, medical symptoms, then it could be due to any other medical condition. So all in all, what you should understand, if you develop vomiting, if it's a vomit which settles within 24 hours and nothing happens and you're getting back to normal, that's okay. But vomiting associated with headache or chest pain or tummy pain or any bleeding or anything, then you must come to the hospital and get medical advices. And anything which could happen during the intestinal system, like gastritis, the pancreatitis, appendicitis, or any bowel inflammation, they all come out with vomiting initially. But these things, the other things, the general, even these things will associate with some other clinical symptoms, which could be diagnosed by a competent doctor. So then if you have some abnormal vomiting, you must come to the hospital immediately or meet your doctor. The doctor will decide this could be settled with some medicine or need further investigations.
And it's necessary for a 36 pregnant lady with pregnancy, is it necessary to deliver at 36 weeks?
It depends on how many placentas the pregnancy is having. We know when it's come to the twin pregnancy, we call it monochorionic and the dichorionic. Monochorionic in the sense, both they sharing one placenta. So there are more complications. So ideally, we take the mother to 36 weeks, is the right time to deliver. But if the babies are developing healthy and the weights are normal, the water levels are normal, both are having both are having two separate placentae, then there's no hard and fast rule to say the mother should deliver at 36 and go to 37. If they're willing to go for a normal delivery, can go further as well.
Certain patients are afraid of getting vaccinated, sir. So they have asked, like, is Lanka hospital is accepting patients who are not even vaccinated?
Whether you're vaccinated or not vaccinated, from the beginning, we didn't say no to any patients. You're from which end you are coming, provided that, for example, now when you come into the hospital, we examine you, we screen you, and you see whether you have any condition which need medical attention. For example, if you have any symptoms of COVID infection, then at the emergency we screen you, and if you have a COVID, then we treat accordingly. The vaccination does not matter, but we advise you to vaccinate. Some do not vaccinate for some reason, but they still come to the hospital. There's no discrimination.
Thank you, sir.
Thank you.
Thank you for participating in this interactive activity. I hope we all answered most of your questions. In case if you want to get in touch with us, please contact us.